So hi, today we are going to be adjusting Mr. James Gorski for his neck. So this is a typical neck adjustment that we usually do for our patients. You know, James is a really young guy, and as you can tell, he's very fit. But with regard to neck-wise, you know, we always check for, again, first thing we always do with all of our patients is to check the range of motion. So James, please turn to your left side for me as far as you can. And we always keep the shoulders back as much as we can. We always talk to our patient about having their nose turn about 80 degrees, which is slightly right before the tip of the shoulder here. And James is almost there. Let's go to the right side for me here. And on this side, he's a little bit less. He's about maybe close to 70 degrees, but close to 80 degrees, but a teeny bit less to the right side. Look straight for me, James. And our bending. Typically, as we get older, our bending decreases quite a bit. Most people really don't concentrate on how well they bend, but that's one of the things that we always do here is to make sure that we get the lateral bend on our patients to come back on them really well, besides the rotational components. So with James, after doing the range of motion test on him, we will palpate and see which segments we would be adjusting for James. So typically we are going to be adjusting his C2 right there on the left and his C4 right on your right side. So with our adjustment, we use what we call a Gonstead chair adjustment, which is very light on a adjustment wise. You know, it looks more aggressive, just the fact that the patient is sitting up and we have control of the neck. And oftentimes patients feel more uncomfortable sitting in a chair, but compared to a neck adjustment laying on their back or lying on their table, a chair adjustment is much more or much less invasive for the ligaments and the tendons and the muscles of the neck, along with any vascular issues, you know, that a patient might have, you know, which we always rule out before we adjust people's neck. So, well, how we're gonna do with James is really simple. All we're gonna do is bend his neck to the left, and with a slight extension, we're going to give him a thrust from P to A, or posterior to anterior. All right, so go ahead and take a deep breath for me right there, James. And breathe out for me, all the way through, and relax yours. Good. Nice job, James. That was easy, right?
Yeah, that was easy.
That wasn't bad. All right, we're going to do the same thing to the right side. And we always come back and double check. Even though we hear some cavitation of the joints or popping noises, we always come back and try to check and see which direction is moving and how well it's holding up on him. Good. So this time we're going to go to the C4, drop all the way to the right side for me. Good. Perfect right there, James. And go into extension slightly and hold it there. Good. That was it. All right. Thank you.